My name is Emily Snyder, and this is my informative speech. First, I will show you my audience. Okay, so a few years ago, I was starting to have a lot of migraines, and with those migraines came a lot of visual disturbances called auras, which are little squiggly lines in your vision. After a few weeks, these started to get a little bit worse, and so I started to get a little worried and did what any rational, sane college student would do. I Googled my symptoms, and Google did not disappoint. According to it, I was having terminal cancer, probably a brain tumor, and was going to die within 2 months. I was a little unhappy with that because I wanted to go to homecoming, so I decided to see a real doctor, who referred me to a neurologist, actually, and after a year of miscellaneous tests, I finally got a diagnosis. Idiopathic intracranial hypertension, which may in the future of the speech be referred to as IIH because it has a really long name. IIH is a rarely talked about disorder that's often misdiagnosed because the symptoms that are caused by it are very common and can be a lot of different things. But it is important to know what they are because it can affect anyone and it is a lifelong disorder. First, I'll talk about what it is. So what IIH is it's your body's inability to properly regulate the absorption and production of cerebral spinal fluid, or CSF. I have included a link to an image of what the CSF does and where it goes in your brain underneath the video below. This increase in pressure caused by a high amount of CSF causes stress to your brain and your eyes, which is what can cause a lot of the symptoms. It's called idiopathic because no one really knows what the cause is, and they can't link it to environment or genetics or anything like that. But there is a way to kind of catch it. You can look out for the symptoms. According to the Mayo Clinic in 2016, the most common symptoms are migraines and visual disturbances. The migraines will most likely be frequent and severe, and the visual disturbances will probably be double vision, partial blindness, or blurriness. You may have a couple less common symptoms, including neck and shoulder pain, as well as ringing in your ears. If you experience these symptoms, you can go to a doctor and get a couple different tests to see if you can get a diagnosis for it. The first one they'll give you is probably a blood panel to see if you're deficient in any vitamins where the deficiency might cause some of the symptoms. If that doesn't pan out, they might have you get an MRI, which will tell you if you do have that brain tumor that Google said you did. If you don't, they might send you to an ophthalmologist who will check the back of your eyes for swelling around your optic nerves, which is the telltale sign of high CSF pressure. If you do have that swelling, they'll likely get you in for a lumbar puncture, or LP, as it's called, which is where they insert a very hollow needle in between two vertebrae in your back to measure the pressure of your CSF, and if it's high, they'll actually siphon some off to bring you back down to normal ranges. Once you get a diagnosis of IIH, there are a couple different treatment options depending on the severity of your symptoms. I did include linked below a flow chart of the severity of your symptoms, and if things don't work for you, what the next step would be treatment option-wise. The first step is a lifestyle change, which is weight loss. IIH is more severe in people who are obese, so it can be helpful for a lot of people to lose about 10% of their current body fat to lessen the severity of the symptoms. If that doesn't work, they'll most likely put you on medications, which come in two different forms. One is one to help manage the symptoms of the migraines, the severity and the frequency. Another one is a diuretic to help prevent the CSF, the amount from getting high. It'll make the water kind of go right through you so that pressure can't heighten. If that doesn't work, you do have the option of getting therapeutic lumbar punctures about every couple months to siphon off the excess. A lot of people look for a longer term solution than that, so you would have two surgical options. The first is optic nerve fenestration, where they will take a scalpel and put just a little slice in the back of your eye, and that can allow the extra CSF pressure to kind of siphon out so that you're not experiencing those same visual disturbances. If you don't want anything sharp or pointy going near your eye, you do have the option of getting a shunt put in to either your brain or to your lower back. This will periodically measure the pressure of your CSF, and if it's too high, it will siphon off the excess through a tube into your abdomen. As you can see, idiopathic intracranial hypertension really is an important disease to know because it's something that can affect anyone. It's a lifelong disorder, and it's treatable if you know that you have it. It can be diagnosed through a multitude of tests, and so it's important that you actually go see a doctor and get a diagnosis instead of self-diagnosis instead of getting a self-diagnosis, because that's about as useful as what Google is going to tell you, which can obviously be very wrong. Once again, I will show you my audience. Thank you very much.